Welcome to Unbiased Science.
Where we bring scientific method to the madness.
We're your hosts, Dr. Jess Steier
and Dr. Sarah Scheinman.
And this week, we are tackling a topic that is so important, and in my opinion, not discussed often enough, the topic of HCP, healthcare provider burnout. This is a very serious problem in the U.S. and abroad, and we have two very special guests who have launched an incredible campaign, which we will link to. It will give you goosebumps, just like it gave us goosebumps, and we really can't wait to talk about it in detail. And just a personal aside, I've talked about the fact that my husband Ethan is an emergency physician, and just seeing him, I've been with him through medical school, through his residency, through his career as a physician, and there, the unique pressures of an HCP and having lives, that literally hang in the balance, under your care, your responsibility, compounded with the healthcare system constraints, administrative burdens. I mean, there's just so much that goes into this. So really, really happy that we're tackling this today. So let me introduce our two guests. So let me pull up their very impressive bios. So first, we have Claire Knapp, who is the CEO of Havas Links. So having started as a graduate fresh out of university, Claire is CEO of Havas Links, one of the most awarded healthcare communications agencies in the world, celebrated for its integration of creativity and science to deliver impact that matters. Claire is an internationally recognized keynote speaker on the mental health of healthcare professionals. ED&I, what does that stand for, Claire?
The D&I, but just in the other way around, so equity, diversity, and inclusion.
Oh my gosh,
okay.
Interesting. Okay, so this is the UK version of what we refer to as DEI here in the US.
DEI. All right.
Within healthcare and the importance of patient centricity in clinical trial design. We're also joined by Dr. Tapas Mukherjee. Did I say that correctly, Tapas? I hope so.
Very good.
Tapas is medical director of Havas Links. He's spent over 13 years as an NHS physician. During his time in healthcare, he specialized as a respiratory physician, but also developed an interest in medical education. His work in this area led to him creating a series of YouTube videos, which reached hundreds of thousands of people and helped to double the number of doctors using asthma guidelines in the UK. After a series of awards and interviews, his work was spotted by Havas Links, and he has now worked at Havas for 7 years and is medical director, where he uses his unique clinical and strategic insights to help new medical brands launch into the busy healthcare space. He also leads the Healthcare Influencer Service, which trains healthcare professionals to become online educators and influencers, partnering them up with like-minded pharma sponsors to co-create engaging and credible education and raise disease awareness.
Ooh.
Claire and Tapas, thank you so much for joining us.
Thanks for being
Thank you
here.
for having us.
Thank you so much. I'm sorry we submitted incredibly long descriptions of ourselves and we then made you read them out. So we apologize in advance
That's
for
not
that.
even close to the longest we've had to read on the show.
Really?
So don't even worry about it. We have had dissertations that we've read.
We have.
Tapas can do his own intro through a song and a dance as well, but maybe we can save that to the end.
Missed opportunity.
That would have been a treat. So, okay. So the campaign that you launched, Healing the Healers. Sarah loves kicking off episodes with the definition, really setting the stage with context. So what is the Healing the Healers campaign?
Yeah, Healing the Healers is a thought leadership piece that we kicked off last year. And it was really focused on exposing and acknowledging the fact that we're currently witnessing the fastest deterioration in healthcare professional well-being in recorded history. It's a piece that looks to understand why that's happening, starts to explore the kind of multifaceted nature of it, and also starts to open up the conversation about why is it still a problem, some of the social and cultural challenges that sit behind it as barriers, and also what we can start doing differently. So it's in a lot of ways, it's a question to us as an industry to try and think about what we can be doing differently to actually tackle that challenge.
And in terms of the logistics. So there's a video, a YouTube video, which we absolutely must link to, and I'm serious. Everyone must go watch this video. We will reshare it to our stories. It made me cry. It made my husband cry. Sarah said it made her cry. I mean, unbelievably powerful. And maybe we could talk through the video. But there's also a white paper. So what does that look like?
Yeah,
What is
so
a
then,
white paper also? Like what do you I don't know I'm sorry, I'm a bench scientist, so I sit there with my little cells and microscope. Like, I don't really know how things work at the policy side. So that's why we have Jess, honestly.
it's just a really long blog, put it that way, Sarah.
Oh, all right.
But
I
it's
like blogs.
the white paper goes through in a little bit more detail. I mean, the video very much is there to set the tonality of what we're talking about, and I'm really glad to hear that it kind of had that response, because we did try to encapsulate the real nature of the challenge that we're talking about. So that's there to kind of open up the conversation, and then the white paper delves into a huge amount more detail around the data that we have behind the burnout challenge, what's causing it, and starts to explore some of the things that we could be doing differently as an industry. And as part of the white paper as well, we also did a number of podcasts, which I don't know if you want to touch on, where we talked to a number of external people about different aspects that we explore within the white paper as well.
Yeah, this white paper was quite different in that we have a theme every year, and we try and do something which is an interesting trend in marketing or advertising or healthcare. But I remember when we presented this one on stage and we kicked it off internally, the thing I remember the most is the number of people coming up to us after and saying that was the most serious white paper and most thought-inspiring white paper presentation that we've seen from Havas Links in years. And I think the reason for that was it was slightly different, almost like a taboo topic that we were taking on. But when we started to delve into the research, we realized that there was no lack of people who really wanted to share their experiences with us. And so it led to us actually then interviewing some of these doctors, but also some of the people who'd lost doctors through tragic events such as suicide and had gone on to set up their own charities or organizations in recognition of this. And we were really lucky, therefore, to be able to get firsthand like what it's like living with someone who's going through like a hidden depression and is being pushed closer to the edge every day because of their work, but feels unable to talk about it. So it was a very different tone, was the other thing I remember. Throughout those podcasts, throughout the white paper, and throughout the research, I really, we realized we were dealing with something very serious, and we were very privileged to be able to release that white paper.
So is that kind of how you gathered the research and the data for the paper? Is you interviewed a good number of these healthcare providers?
Yeah, well, one of our service offerings is that we actually have a data product. So we survey thousands and thousands of doctors every year across the world. So US, EU4, UK, China, Japan, and Brazil. So the reason this white paper was actually born was because we were launching this data service and we suddenly started to see this trend reoccurring across every market and every speciality. And that's when we realized that burnout was something that we had to talk about and we had to create a platform for, because it was just bubbling up through the data that we were collecting anyway. And, at being one of the largest healthcare communication agencies that there is in the world, knowing that almost everything that we produce as an agency is targeting healthcare professionals, we realized that it was kind of our responsibility to actually tackle this conversation and start to create a platform so more of us can discuss it as well.
So through those interviews and through those conversations, is there anything that really, I mean, I'm sure so much resonated, but is there anything that really jumps out as being particularly impactful? I can't imagine having those conversations. I would imagine they were pretty raw for a lot of the HCPs who participated.
Yeah, I mean, so we did the interviews. We also did written surveys so that we could get quantitative data, including things like PANA scales as well, so that we could get a view of emotions in the last week. And I think one thing that hit me, and I don't know if it was the same for you, Tapas, but one thing that hit me was just the pure scale of what we're talking about. It's close to 90% of healthcare professionals feeling distress because of work on any given day. So this isn't something that's, like sporadic or just in pockets. This is something that is hitting the entire healthcare professional workforce, and it's something that we were seeing just as equally in Brazil and China as we were in the US. I mean, it was something that we were seeing in millennial healthcare professionals just as much as we were seeing in older or younger healthcare professionals, and across all different specialties. So for me, the thing that was most staggering was just the pure scale of it, and the fact that it'd been allowed to kind of fester for such a huge amount of time without really being kind of acknowledged, spoken about, or tackled.
I think also the scale gave us permission to talk about it and not be fearful that the research was too UK centric, which is something that we're always mindful of. But the thing that I remember, and it really personally hit me as well, was the number of physicians who said they didn't trust other colleagues at work. I found that was very sad, but it definitely resonated with me. When I was in my final stages of leaving the NHS, I went through perhaps slightly similar feelings. The other thing that I remember was we had gone into it expecting it to be a story of burnout due to workload, and it wasn't just workload related. There were so many other issues which we uncovered, and I suppose that was really useful. Things like, and we may touch on this later, but the role that the media was playing in making people feel paranoid or unhappy or not feeling worthwhile at work, the role of colleagues, the role that the patients can be playing to make the lives easier was perhaps sort of, quite enlightening. So the ones that I really remember, though, is the mistrust, and the other one is about 30% of doctors saying that they felt lonely at work. I think that's another really sad one that came out of it.
So you mentioned that this was an issue across specialties, but were there any patterns? And I'd love to talk in a bit about the difference, perhaps, between the UK healthcare system structure and the US. There are some things, at least here in the US, that I think really contribute quite a bit to feelings of burnout. But in terms of specialties, did you notice any trends?
Yes, it was equally true across, well, it was true across all specialties. There were a couple where you've got even higher rates of burnout. So oncology, if I remember correctly, featured quite highly, particularly when it came to suicide. Actually, there was emergency care, which off the back of the pandemic, I think is probably an exacerbator of that.
Right.
But I think it's fair to say that, even dermatology, there was a significantly high increase in burnout rates over the last decade. So some of those therapy areas where you might consider them to be kind of less pressured than an oncologist or a neurologist was still seeing this increase in burnout. So it's true across all specialties.
Yeah, and the other thing that was quite interesting, I suppose there are some country stereotypes you might like, in the US, perhaps there's a bigger fear of litigation, understandably, perhaps, compared to the UK. But I remember something quite interesting was that in Japan, we had a little bit of information about Japan. And in Japan, my understanding is in the culture, it's very rude to go to either extreme of a survey. So the answers never really deviated much from I'm feeling okay. And so slight deviations there, we had to learn how to interpret that in the context of that particular country's culture. And that was really interesting, that if a doctor is saying they're okay in Japan, it doesn't necessarily mean they're okay. And so it was a learning for us as well, that we have to understand different cultures better to understand the data in the first place.
And maybe tailor the measuring tools as well based on where you're conducting the survey.
Exactly.
Definitely. The other thing that was identified as we started going through is that there's an element of intersectionality that we were seeing as well. So although all healthcare professionals have got higher rates of burnout than they did previously, that's particularly true for any kind of minority healthcare professional or marginalized healthcare professional. So there was even higher rates of burnout for female doctors, for anyone that identifies within the LGBTQ plus, racial and ethnic minorities. So any of those groups also had even higher levels of burnout, which I think is probably reflective of the fact that they're dealing with a couple of types of pressure and stigma associated with that.
So you just said something, Tapas, just before. I just want to go back to it because I think it'll really pique the interest of our listeners. So is litigation, because I'm glad you mentioned that. Here in the US, that is such a huge issue. Often it's said that doctors are practicing defensive medicine, where they tend to, order a lot of tests and, and imaging and things like that because they're so scared. We call it, I'm putting myself in the HCP community, CYA medicine, cover your medicine, right? And that's what folks say.
I've never heard that before.
Yeah. So is
I've
that
heard
not
defensive medicine though.
So is that not a thing? Is in
No,
the UK?
so funnily enough, so we were expecting to see that in the US, like 100%. We saw it across markets. So, for example, in the UK, there'd been over 130% increase in the amount of litigation against individual doctors in the UK over the last 5 years. So it was something that was true across the board. And I think that actually exposes something that was one of the primary drivers, because this isn't like a single thing that's causing this trend. But what we overall saw was that the reward for being a doctor or a healthcare professional has started to diminish significantly. And yet the value they get back hasn't countered that. And so the litigation is just one of those aspects of being less and less rewarded and seeing less and less value for the role that they're doing. And if anything, being held accountable for things that are often out of their control.
Yeah, that's a really good point. But the other thing that I was just remembering was that a burnt out doctor is twice as likely to be involved in a medical complaint or an error. And even before this, I sort of roughly remember this fact, which is something like 70% of all the medical complaints are deemed to be due to poor communication. And what became clear through this process was that when you are dealing with someone who is incredibly stressed and perhaps feeling paranoid and practicing defensive medicine, their communication tends to be a lot worse and their receptivity to education tends to be a lot lower. And so you're more likely, therefore, to be having a worse like doctor-patient relationship, to be learning less, to be not changing your behavior. And so it's a terrible sort of like combination of events, which has a downward spiral. And that was, something that we uncovered, I think, during this process.
So I have sort of what might seem like a very basic question, but Jess alluded to in the beginning that I love a definition. So what exactly is burnout? Like when we're talking about a burnt out physician, like what does that look like? What are some of the signs that someone that like I could look for in, say, a friend of mine who's a practicing physician?
This will be one of those where we have to probably look at the definition properly and redo the recording for this bit, because I've forgotten the definition. I'm going to have a quick look in our own white paper of how we defined it. Well,
I love them any more than I do, honestly.
It doesn't have to be like a Webster's dictionary definition. I mean, just like in general, like what are we talking about? I didn't mean to put you on the spot, but I just mean like in general when we're talking about.
Thanks, Sarah.
I'll give you a rough idea. So I think we'll wait for the recording to catch up, shall we? So I would say it's a doctor that, to some extent, is no longer finding pleasure in their own work and feels that they're not able to cope with the day-to-day. It's normal to feel pressure. It's normal to feel anxious. But when that begins to overtake your own life, when it starts to impact on your decision-making ability, when you start to make mistakes, or you start to have really negative thoughts, and right over to the other extreme, when you start to have suicidal thoughts, this is clearly not healthy. The scary thing is, I think it's a bigger problem than people like to admit. And what has become apparent through this conversations that we've been having and through the stats that we've uncovered is that if more people were really honest about themselves, or if more people felt they were able to speak up, we would actually realize that the number of burnt out doctors is higher than we appreciate.
So I've done, honestly, quite a bit of content on this topic on Unbiased Science. I mean, this is sort of my love letter to my husband, watching his struggles over the years. And I know I've talked about that, but I feel like there's nothing I can say that would actually capture what it's like to see him come home, at just the pain in his eyes after losing a patient that he tried so hard to save their lives, and then delivering the news that this human life is lost and the person died. And I personally, I give HCPs all the credit in the world, because I couldn't manage that. But then on top of all of that stuff, you're dealing with a lot of administrative burden. And I mention this because I can't imagine juggling that on top of everything. So I'm going to use, again, my husband's example as an ER doc. He is often held to certain throughput metrics, process metrics. So you have to see a certain number of patients in an hour. Oh, but then at the same time, you're also, patients are getting satisfaction surveys. So you need to spend enough time with the patients. They need to feel seen and heard and also receive proper care. So it's this constant fight between seeing a number of patients, but also giving proper attention to patients. And I think that could be a really difficult balance to strike. Is that something else I would imagine that's a universal thing, not just specific to the US. Did that come up in your analyses?
Yeah, absolutely. I think admin and workload were some of the biggest drivers across the board. I do think what you touched on there is particularly compounded within the US because of the commercial nature. Healthcare in the US is a business. Therefore, the number of patients you see isn't just a factor on waiting times, it's a factor on turnover and revenue. So
Right.
That is particularly bad within the US, I would say. And the other aspect that we found quite interesting was just the level of cognitive burnout. So I always go back to the fact that if you took all of the medical knowledge in the world and go back in time, it used to take 50 years for that knowledge to double. Now that medical knowledge is doubling in the world every 73 days. And yet the way we communicate that knowledge, the way that healthcare professionals are expected to keep up to date with it hasn't really changed. And so you've just got this fire hydrant of information that's hitting healthcare professionals. They can't digest it. They can't kind of process it quickly enough to be able to apply it into their practice as well. So I think there's this really interesting combination of more patients, more complex patients, more information that they need to be able to process, as well as more admin and red tape that they're kind of wading through as well.
I remember we interviewed one doctor in the US actually who made this comment that they are expected to know ever increasing amounts of information and then expect to rule all of that out for the patient in front of them, but the amount of time has not increased, even though the process is now massively increased, and the expectation has risen from both the public and the hospital and the administrative team. And so they inevitably go home every day thinking, what are the things I've missed today? And what are the cancers or the children that are going to come back, or the missed diagnoses that are going to hit me a year from now? And that is an incredible building amount of stress every single day to be living with, which I don't think it was like that maybe several years ago, and that we can only see that problem getting worse.
Which I think is it comes through when we look at the volume of moral injury and moral distress, which was incredibly high. But I think you get into this profession because you want to do no harm, and ultimately you want to make people better. And the fact that you go in knowing that you can't physically give everybody the amount of time that they deserve, you can't physically go through the amount of information that's needed in order to produce the optimal outcomes, that in itself is actually creating this idea of moral injury and moral distress on healthcare professionals, which in turn is kind of making everything else worse. So you do create this spiral of decline, as you called it earlier, where the parameters that are causing this impact, the consequences of that is only making those parameters worse.
Yeah, and I mean, it sort of seems like there's this catch-22 here, because like you mentioned, there's way more information that physicians are expected to consume and sift through when making a diagnosis. But then at the same time, you guys also mentioned that there's less and less time that physicians can stay with that patient, because they have to reach, at least in the US, they have to reach this threshold of the number of patients that they see like in a given day that Jess was talking about with her husband.
Mm-hmm. Not to mention things like charting, right? You have to have very clear, like Ethan is constantly, he's home, but he's working on charts in his off time, and you do that. You have to be very careful about charting, because then that's directly, could protect you against litigation if that were to be the case, properly
Which is that
documenting
defensive medicine thing that you were talking about, right?
Exactly.
And the tools haven't kept up. Like we work, like now that I work in this, communications world and the corporate world, I'm surrounded by tools that help me every day. AI is obviously the one that we're all talking about right now. But it's interesting when I speak to my wife, who's still working in the NHS, I forget you sometimes forget how slow it can be for the latest technologies to percolate through to the everyday lives of doctors. And so they're still doing things what you might consider the old-fashioned way sometimes, with paperwork and trying to print things and even using fax machines. And these are also everyday stresses, just the simple things of trying to print a document so that a patient can go home. Even though we have EPR systems, electronic systems, the end result is that you have to give this physical letter to the patient before they can be discharged. And you have to do that before a certain time, to meet these standards as we're talking about. And these are all just little stresses that we forget. There are so many problems that we could be trying to solve, like the printer that doesn't print, which would make a doctor's life so much better. It's frustrating and it sounds comical, but like these are real problems that we were also hearing.
Mm-hmm. And, also compounding the issue is that patients can sometimes be quite violent. They can harass HCPs. There were just a couple of cases in the news that got quite a bit of media attention here in the US, where there was a nurse who was attacked so badly she ended up in the ICU. I mean, patients are understandably, right? You're feeling either sick or, you're scared and you're put in a situation, or perhaps there's also some, mental distress, and then you feel like you're not being seen or heard quickly enough.
There's I mean, there's almost a risk, I think, sometimes that doctors and nurses are portrayed as superheroes. And we certainly felt a little bit of that. We saw a little bit of that during the pandemic, that they were portrayed perhaps a little bit too superhuman. And that comes at the cost of forgetting that they also have their own families and their own feelings, and they're only human and they do make mistakes. And there was this very superficial exercise of us clapping every Thursday for our healthcare. I think it was called Clap for the NHS or something. Every Thursday we used to go out during COVID and clap in appreciation of all the healthcare workers. What I have been struck by in the news is that the number of people demanding better from their healthcare and, like you say, attacking healthcare staff has risen since COVID. Those expectations just continue to rise. And the same public that was clapping for them now are, attacking them. And so that's something that I think we are very conscious of, and the pharma industry also needs to be conscious of, which is painting doctors as perfect, because it doesn't work that way, And
I think also you touch on there a little bit, but the media attention aspect of this was something that we found fascinating as we started to crunch the data. So what was interesting is that when you asked healthcare professionals what their biggest kind of burnout challenges were, it was often kind of workload and patient volume and patient complexity. When we did a regression analysis on the data, media attention came out as the number one driver of burnout. And that it was something, I think it was half of all doctors said that media attention put them under extreme pressure. And there was a little bit of variance depending on market. I believe China was the highest level, Brazil was the lowest, but Brazil was still 47% of healthcare professionals saying media attention put them under extreme pressure. And it starts to make a lot of sense, because when you read the headlines, it's often around like waiting times and poor care and stuff, but it essentially blames the physician themselves for the challenges that the system is putting them under, as opposed to pointing the finger towards the system and the organisations and the governments that make those decisions. And I think what you described there is equally true. It's very easy to point the finger at an individual and make them accountable for it, but they're doing their best within a system and a structure which is fundamentally broken in pretty much most markets at the moment, and that in itself is creating a huge amount of stress and pressure for physicians.
And so as a result of all of these factors that we've discussed so far that are contributing to burnout, when looking through the data in all these different countries, are we seeing problems with retention of physicians within the profession? Because I'm just thinking it takes, at least in the US, I know it takes, you have 4 years of college, 4 years of medical school, at least 3 to 4 years of residency. It takes so long to train a healthcare professional, and a lot, not to mention the money and the structural contributions, but and then so are we seeing some amount of physicians that are just thrown in the towel because of all this?
Yeah, 100%. The WHO estimates that we're going to be 10 million doctors short by 2030.
Wow.
Which is Horrifying.
You know, even when I went into med school, which was it wasn't, it was 1999. I'm even older than I realized. So when I went into med school, 25 years ago, it was still seen, I think, as a profession that you would have for life, like a vocation, and this was your identity as
Right.
well as your job. And I think we have a white paper about this as well. In fact, Sarah, if you want to look at another white paper, it's called the Millennial HCP White Paper. The generation of doctors that we have now certainly view it sometimes as a stepping stone to something else. It's no longer seen as that lifelong job for many reasons, because this new generation like experiences. They don't want to have their job define them. They want to build their portfolio and experience the world, but also because the profession is just simply not as rewarding anymore, and it's too high risk, and there's a risk of burnout, and they don't want to give their life to this. They want to have their own life.
I mean, this is UK data, but from our point one data set, we know that there's about a quarter of all healthcare professionals in the UK intend to leave patient care within the next 5 years.
Yeah.
And what was staggering about that was that it was actually higher for millennial doctors compared to Gen X. So it was about the same as boomer doctors are going through retirement. They're about to leave care. Just as many millennial healthcare professionals intend to leave patient care over the next 5 years. And to your point, I think there's burnout. There's a lot of drivers behind it, but yeah, it's a ticking time bomb for what that means for healthcare and for patient care around the world.
And in the US, we are seeing similar trends. It does differ by specialty. Emergency medicine is by far that's the specialty that folks are retiring the soonest. I mean, here, and again, I don't know if this is a US specific thing, but we have a crisis of not enough primary care providers, and so a lot of folks are using the emergency room for primary care, which leads to
exactly the same.
crowding. It's a mess. So for a variety of reasons, we're seeing basically a mass exodus out of emergency medicine, and then also seeing numbers drop in terms of people who are going into emergency medicine for that very same reason. Also, sorry, go on.
Oh, I was going to say one positive thing, which is that when I was training, one of the big challenges I had was that I went down this route of medical education, and it was quite a quirky route of using YouTube to educate, and back then it was a strange thing to do, and it wasn't encouraged by everyone. And it was very difficult if you had something like that to develop it and keep your NHS job, which is ultimately why I ended up leaving. But I think since then, one of the great changes has been programs such as the Clinical Entrepreneur Program that we have in the UK. It's now one of the largest in the world, I think, in terms of an innovation accelerator for doctors. So doctors who have an idea and want to develop it, however quirky it is, that program like that allows them to get really nice coaching and mentoring, exposure to industry people like ourselves without having to leave their day job. The sad thing is, NHS England is now, being cut. It's being changed, and in the next 2 years, that'll disappear, and it will go back to being called the Department of Health. And so, programs like this, we don't know at the moment what their long-term future is like, but they do have a real value in helping to reduce that brain drain of doctors who want to try something else while keeping the safety of their day job. So I hope that those programs continue, because we've partnered with programs such as that, and we offer mentoring to doctors who are in that situation. And that wasn't really available to me when I was going through that process myself.
So I think this is a great transition, because my understanding, would you say the primary goal of the Healing the Healers campaign was it to raise awareness of this issue? And then, as a next step, are there advocacy efforts underway? Can we talk about maybe some resources for HCPs who are experiencing this? I can share some US specific ones, but maybe even just more globally, generally speaking.
Yeah, definitely. I think, the objective of the white paper was raise awareness, acknowledge the problem, also start to battle some of the stigma. I think there's a huge amount of stigma within mental health, within healthcare professionals that needs to be kind of discussed and overcome. And then, what we've been doing going forward is thinking about kind of small to big activities that can be done to start to tackle and reverse some of this trend. So I can talk about some of the pieces that we've been looking at with some of our clients, or there's also some beautiful work that we've been doing with Doctors in Distress, which is quite a big charity within the UK in this space. And as I say, would love to kind of flag UK Doc, which is another resource and partner that we worked on with the white paper, who are starting to produce some of the resources and support groups that are required, I think, given the extent of the challenge.
And also from our own point of view, it's allowed us to shine a light on the work that we do with the pharma companies that we work for. We were saying earlier that we shouldn't portray healthcare workers as superheroes. Similarly, we should be realistic about how we portray patients. And how many times have you seen pharma ads that show people skipping on a beach or climbing up a mountain, and it's simply not realistic for the people living with those conditions? And similarly, the world isn't like that for the doctors treating them. And so recognizing and being mindful of the reality of their situation and finding ways to cut through the noise, resonate with them while still representing the needs of the pharma company is a personal challenge for us, but it's one that we're keen to tackle and make sure that the campaigns we create are realistic, credible, clinically on point, and resonate with our audience. So it's allowed us to really sort of refresh that as well, I think.
So there's an incredible foundation that I became aware of here in the US. I just want to give them a little shout out, and this is not sponsored or anything like that. But it's called the Dr. Lorna Breen Heroes Foundation. And this was a foundation that was launched by the family of Dr. Lorna Breen, who is an emergency physician who died by suicide early in the pandemic at the age of 49. And so her family started this incredible foundation, which on their website, which we'll link, they have created this incredible suicide prevention resources sort of database that's tailored to the unique working conditions of healthcare providers. They have these innovative training models. I mean, there's all these initiatives, evidence-informed initiatives that they've launched, and they've also been very involved in advocacy, and they actually contributed to the passing of the Dr. Lorna Breen Healthcare Provider Protection Act, which was first of its kind law to support health workers' mental health and well-being. It was enacted in 2022, and the law has transformed and saved lives and improved the systems in which health workers are educated, trained, and practice. I mean, it's really incredible, and it received bipartisan support. Anyway, I'll share more about this.
I was going to say, like, along those lines, I just want to ask if there's anything else that gives you two hope that this crisis is being meaningfully addressed in the UK, abroad, just in any context.
I mean, I'm not sure if it's hope, but I don't think we have a choice, really. I mean, to your point about the exodus of healthcare professionals from the system, if we don't heal the healers, who's going to heal us? Like, we need healthcare professionals to be firing on all cylinders, to feel, confident and resilient within the spaces that they are, or the consequences are, almost unimaginable. So I think the fact that there's more of us having these types of conversations, more of us exposing the challenges, the risk, and the consequences of this trend means that it becomes an unignorable problem. And as a result, I'd hope that we can all take the collective action necessary to be able to reverse that trend.
I think the charity you mentioned sounds phenomenal. I think they do incredible work, these charities. Again, going back to what I was saying earlier, sometimes the changes seem to take a little bit longer in the hospitals themselves. But we have seen small changes. One of the things that became apparent through the interviews was that it's more acceptable now than it used to be when I was a junior to talk about mental health. There's more recognition of mental health problems. I have seen congresses in the last few years where there are quiet reflection spaces where you can go and you can talk to someone if you need to get help. Even the introduction of things like a creche when you're traveling, when you're abroad at these congresses, so that if you're a young parent, whether you're male or female, you can take your baby and still get the education. Things like that just simply didn't exist before. So I think there are small steps being made. Obviously, a lot more needs to be done.
Yeah, and the response we've had from industry, I think, on the white paper has been really encouraging. I mean, we're working with a number of clients to tackle this issue. So, if I say sales reps, most healthcare professionals would roll their eyes, but we're working with a couple of clients to retrain their sales reps to become mental health first aiders. So instead of every discussion ending on, can I count on you to prescribe brand X? It's you're under an extreme amount of pressure. How are you really doing? And helping triage through into the right support materials. We're working with clients to overhaul their congress stands into wellness centers, even down to simple things like you'd be amazed by the amount of stress that trying to find a parking space puts on healthcare professionals. And so I think it was something like 2 hours a day on average they spend trying to find a car parking space in the UK. And so working with clients to think about how can we sponsor car parking spaces? How can we work with the local areas so that people with driveways can give up their driveways so physicians can just kind of park and go straight to work? It's down to the very smallest thing. And up to the very biggest kind of policy changes that I think will start to make the necessary changes.
Another idea we were exploring, I can't remember how far this one got, was can we provide healthy meals to doctors during shifts? Because it's so demoralizing when you're working and you have to go to a vending machine and get a packet of crisps during a 12-hour shift because the canteen is closed, or you're not allowed on certain wards, you're not allowed to take something off the tea machine because it's only for patients. And so, these are problems that is everyone's problem. Everyone should be thinking about how to solve these.
I love that you're thinking about those things. This isn't like a cookie cutter solution. Like you're actually thinking about the factors, as you said, Claire, big and small. I mean, the number of times Ethan has come home and said, on my feet for 16 hours and truly just had a bag of potato chips out of the vending machine, didn't have a chance to go to the bathroom, didn't have a sip of water. But your point about parking spots, I mean, these are things that we don't consider. But when you're rushing to a shift, you're already anxious about going into it.
Yep.
That could be the thing that pushes you over the edge. So really, thank you so much for covering this topic, for giving the attention it deserves. We're so honored that you were a part of this conversation and that you're doing this incredible work. And also a huge thank you to the HCPs who are listening to this. Your work, your efforts, really your tireless dedication to keeping us safe does not go unnoticed. And thank you so much. And we hope that there'll be more attention paid to taking care of you and healing the healers, as Hava so beautifully said. One final thing for our U.S. listeners, of course, we have the 988 suicide line if you are in immediate crisis. There are also some HCP-specific resources like the physician support line, 1-888-409-0141. It is free, confidential, and anonymous, and it's run by volunteer psychiatrists specifically for HCPs who are experiencing burnout. Tapas and Claire, any final thoughts that you want to leave us with? And actually, I'd be curious if you would be willing to share any other projects that you can talk, just very high level, like just give little teasers, because I have become such a huge fan of your work and your organization.
I could mention Shining Thanks, because I think that's a really nice tangible example of something that is really replicable. So Christmas last year, we knew, so burnout rates for physicians is normally higher over the Christmas period because volume goes up. The days are longer, the nights are longer, which has an impact, and you're away from your family. So we ran a campaign with Doctors in Distress last year, which is called Shining Thanks on the Darkest Days, where we basically collected really heartfelt thank you notes from around the community within the UK. So, as a thank you to the nurse who held the hand of my dying father when I couldn't get there in time. Thank you to the midwife who supported me through some of the hardest parts of my life. Thank you to the neurologist who saved my life time and time again. Loads of these incredible notes of thanks and gratitude. And we projection mapped them onto the side of hospitals around the UK. So as physicians stepped out after 16-hour shifts, the first thing they saw was these notes of thanks, and we had healthcare professionals coming up to us in floods of tears, just saying, you don't know how much I needed to see that thank you in this moment. And we used those as an opportunity to also kind of go, look, if you're struggling at the moment, please head to doctorsindistress.co.uk where there's support available. And they saw a huge increase in the amount of resources that were downloaded in that week. And for me, that's just a really beautiful example of how far a simple thank you can go, and just, you know, capturing that moment as well was really beautiful. So we're working on a Shining Thanks ×2 at the moment. So hopefully there's more of those kind of projects and opportunities that we can push through around the world, because it does, you know, it does start to bring you a little bit of hope in this topic of tragedy.
Well, you've made me cry, so thank you.
I'm hopeful. I mean,
Yeah.
I
I'm
can't
so
top that.
grateful
I
to
have
you two for
nothing. I
doing
have
that.
nothing to top that. But at least, I can say this has allowed us to reconfirm that good pharma, good business, and good mental health can all overlap. Like, it's not one or the other. And
Right.
although it's not always easy, there is a way that we can achieve all of that, and that's what we're trying to do.
Takes a village, is what I'm hearing.
Yeah,
Takes a village.
exactly.
Yeah.
Oh my gosh. Thank you both so much for joining us and for all the work that you're doing.
Yes.
Oh,
And
thank you
thanks
guys
to
for
all
having
of
us
our
on.
I appreciate it.
Thank
Thanks
you.
to all of our listeners for tuning in. We hope you learned a thing or two. I certainly did. This was just truly phenomenal. Please tune in next week on your trusted source for no nonsense, just science.